Well, it should be.
Good evening, Professor. Can you hear us?
Yes, can hear.
Okay, great. I think even though you see only a few students through the camera, there are about 30 people here in this room. It's because everybody understands that this is a very important topic. So, good evening, everyone. Welcome to the 5th session of the Emerging Scholars Research Program. Professor, as we shared with you in the presentation, this is a very special program that we have designed mainly for undergraduates, and also we have teaching assistants here. So first of all, they just go through a course which comprises of many topics which are really important for research, starting from how to write a proposal, then just like this, research ethics, and then it will go towards publications, and then how to protect the intellectual property, how to go towards technology commercialization and all these things. And once that's been done, then they will be allocated to research groups where they will conduct research. So mainly the undergraduates are from the second year. So they have 2 more years to do a good research project. So the objective of this program is to make sure that we come up with a good product so that while they obtain their degree certificate, they have some understanding on research as well. So we selected only 20 students for this program through a rigorous process, and now they are going through this process. Let me formally introduce the speaker today, a very eminent scientist and a very practical person. So that's Professor Pandula Siribaddana. Today's topic is going to be ethics in research. I feel that it's going to be the most important topic in this session, because if you don't have ethics, there's no point of doing research, right? So let me formally introduce. With over 17 years of experience in the fields of digital health and medical education, Professor Pandula Siribaddana is a professor at the Postgraduate Institute of Medicine at the University of Colombo, where he leads the postgraduate programs in biomedical informatics and board certification in health informatics. Professor Siribaddana received his MBBS degree from University of Colombo, a postgraduate diploma in medical education from the same institution, and a PhD in medical education informatics, health informatics from the University of Oslo. Additionally, as the in charge of the Medical Education Resource Center, he has contributed to training over 1,000 specialist medical professionals as trainers and examiners for postgraduate programs in medical and surgical specialties. Professor Siribaddana serves as a consultant to Health Data Collaborative of the World Health Organization, based in Geneva. In this role, he coordinates support for countries in the Asian region with a focus of strengthening health data and health information systems. As a part of this effort, he has led the development of the HDC's country partner mapping tool, which is being implemented in multiple countries across Asia and Africa. This tool facilitates better partner alignment and coordinated investment in health data systems at national, regional, and global levels. He has also led several digital health innovation projects, both as the innovation lead of the Commonwealth Centre for Digital Health, UK, and as a consultant to Analogy Partners PLC, New Jersey. These projects, which involve developing cutting-edge technologies for consumers, cover areas such as oral health, skincare, immune disorders, infancy, and early childhood disorders, maternal care, and responses to pandemic situations. Since 2016, Professor Siribaddana has led the Commonwealth Digital Health Awards, contributing to the fostering of innovation by working with entrepreneurs and startups from across the globe. In addition, Professor Siribaddana has served as the Secretary of the Ethics Review Committee at the University of Colombo, and he serves as an honorary member in the SLTC Ethics Review Committee, which is a great honor for us and a great resource and asset for us. He's in our university's Ethics Review Committee. So thank you very much, Professor Siribaddana, for accepting our invitation, and over to you.
Oh, actually, unfortunately, my camera has a bit of an issue.
Okay.
Slides. So until I, some of the slides I have done, I think I've kind of lost it. So I've tried to find it out as you introduced. But I guess we could start, and I can probably go through what they have already probably have been exposed to, and then probably build on that as well. But just give me a minute until I kind of...
Sure. Take your time, Professor.
I'm wondering whether you can see this.
We can see the screen, Professor.
Right. Okay. So sorry about the delay. It's a pleasure for me to kind of be part of this and also to give a brief. But I would say it's a background, because you probably do use it in terms of developing your own research work based on these inputs. I'm not really going into a lot of theory behind ethics, but what I would like to do is to discuss ethical aspects related to, well, mostly in terms of research development, how, in the context of developing a research protocol or a research report, but try to touch upon some of the ethical concerns related to each of these elements, because we always have this, idea that ethics is perhaps only related to ensuring privacy, confidentiality, and etc. with regard to the study participants. That is one important aspect of ethics, but at the same time, our entire research protocol development or the research design kind of influences the ethical aspects related to our study as well. Meaning that whatever we do in terms of research requires careful consideration at each step of the way. So what I would like to do is to still be a brief session. I don't want to kind of go into much depth, but for you to kind of explain some of the ethical aspects related to the different components of your research work. So Lakshita, will that be okay? Will that kind of...
That's fine, Professor. That's great. Yeah.
Okay. Okay. Before that, can I just know, what's the sort of research exposure that they may have, you all have had during this period?
The majority are beginners, Professor. So they are in the second year of their undergraduate life, and there are some TAs as well who have gone through the undergraduate research program. That's the background. Mostly they are beginners.
Oh, all right. Let me just go through, and then if there's anything, we can have a Q&A afterwards. Right. Now, many of you would be undertaking technology-related research projects. And in such instances, our main focus is, of course, the development of a system or the software or the coding part of it, the digital part of it. That's what we are mostly concerned. However, when we are talking about research in the digital environment or engineering or any related technology field for that matter, there is an important element, it's an important need for us to address robust research design, which is essential to uphold ethics, ensure ethical practices during our whole research projects, and that's the kind of thinking that I'm using in terms of discussing ethics in relation to your own area of study. Now, we'll start from the beginning. I have structured this to match what you will do in terms of developing a research project, because that's where the ethics will be discussed at length, or ethics will be first looked at before even we undertake the study itself. Now, for example, in terms of the title of a research study, what are the sort of ethical aspects that you would think that would matter? Any ideas? I don't know whether they will be able to talk.
Can they talk? Hello, Professor. Can you hear us?
Yes, can hear.
Yeah, I think you can answer if you have any answers. So there's only one microphone, Professor.
Oh, really? Okay, okay. So I wouldn't. But if there's anyone who would want to kind of touch upon this, that'll be good. Okay, if I may kind of explain, when you make a publication or when you submit a research or a research proposal for that matter, this is something that we will first look at, the title. Why? Because we expect the title to explain what you actually did in your research. Now, in many instances, what can happen is the title may be deceiving. The title may not really talk about what you have done, but it may talk about, probably it's your vision, probably it's something that you had in mind, or something that is related, but not really what you have done. And that's an important thing for us to remember, because ethics starts from the first impression itself. Now, what we usually try to do in a title is to keep it clear and very specific. By doing that, we are making sure that nobody will have nobody will have a misunderstanding about what this research is all about, or anyone will not be deceived to follow the study, because there is a tendency that somebody may just look at the title and then straight away go to the go to the study conclusions and then make those links, which is not really what we want to happen. So keeping that in mind, especially given that today's social media and other media where the information disseminates very fast, a false move means dissemination of false information. So the title starts off with a very clear, very specific set of words that will explain what you have actually done. And for example, sometimes when you say a title like AI in radiology, it's too broad and it's not really indicative of what you have actually done. For example, in conclusion, if you have said, in this study, the AI-based analysis of images, which you may have only focused on a specific set of images, but not really all radiological images. If you have said the AI sensitivity or specificity is very low, somebody might kind of interpret this as AI is not really good for radiology, which is not the interpretation we want them to have. So a better title in that case would be a very specific title, which basically tells what you did. For example, here it says comparing AI and radiologists in detecting lung nodules on chest X-ray. a multi-center study. So this is a kind of a title which is clear, which is specific, which has less chances of being interpreted wrong. So this is one of the first things that, as a in the ethics review committees, we look at that to ensure this particular study conveys what it has done. Okay. Any questions? Any clarifications? Lakshit, anything that you
I
would like?
think well said, Professor. Yeah. You can move on. Yeah.
Secondly, we would also want to know whether there is a justifiable reason for undertaking this particular study. So when we receive ERC proposals, what we first do, what we do secondarily would be to look at, is this study really addresses a gap that has been recognized, and whether this addressing of this gap is benefit to the population being studied, or to the practice that is being done. So as unless you address a specific gap or a issue at hand, on one way you are doing a study that will waste resources. On the other hand, there is likelihood that that research may lead to harm than the benefits that are expected. Because whatever we do, even in research, there will always be a balance in what you do. For example, if you develop an AI model, there is always a chance that it might cause erroneous judgments. But what we try to do is to make the most of it and increase its sensitivity, specificity, and to be more accurate as much as possible, so that the impact of erroneous suggestions would be as minimum as possible. Even in medicine, that is usually the case. So this background and justification is really important. That also helps us determine whether this particular problem can be addressed by the researchers concerned, because certain instances we may know that certain research projects might not really be scoped well to address that particular issue, because that would require a lot of resources, a lot of inputs, expertise, which the research team might not really have, and that ultimately will lead to a lot of issues around that subject. So the background and justification of research is important, because it tells us why this study matters, what is already known and what is missing, and also gives real world examples to illustrate your point in terms of why you do this study. And that's important for us as ethics review committee members to understand, and understand the benefits or the harm of your study to the population concerned. Any questions related to this?
I hope there are no any questions, Professor.
Okay. Either you understand everything or you don't.
It's very clear. It's very clear.
All right.
Very interesting and clear.
Okay, thanks. All right. So the third thing is the research question. Now here, this is one of the key things in any research proposal development. You will note that having the best research question is perhaps the winning moment for you in terms of getting this research done properly. So having a good research question always helps. Now, this also leads you in the proper path, and that's how you get to from A to B in research. Now, from an ethics point of view, the research question helps you determine whether this particular research is justifiable and whether this particular research targets the intended population, and how that, whether the measures that you are going to use, in the sense to say that whether this research outcome is accurate or not, whether those measures are relevant. And that is where we use systematic means of developing research questions. Now, of course, in technology field, there may be other means of making a very structured research question, but one of the research questions that we use in medicine, the frameworks that we use in medicine is called PICO, which refers to 4 or 5 different things: the population, the intervention, the comparison, outcome, and the time frame. In essence, your research questions will first talk about who this research is intended, or subjects of that research. So it may be a patient population, it may be a set of people who are using technologies or digital systems. The second, intervention, is probably something that you give this population to work on, or something that you observe, a practice that they may be using. For example, it may be a tool that you have introduced to that particular group of people to use in gathering data or to do various things. Comparison is a gold standard or a standard that you may use to compare between the people who are using the intervention and the standard practice, because then only you can tell whether that's better or not. And then the outcome is what you actually measure. This is an example. Now, of course, we don't promote using broad research questions, because it's not easy for you to then address the intended outcomes. Your data will not tell us what you are proposing. But a question here related to technology would be, how does AI-assisted lung nodule detection compare to radiologist interpretations in terms of sensitivity and specificity on chest X-ray? Now, imagine you plan to develop an AI model to automatically detect, say, cancers in the lungs using an X-ray. So, at the moment, people or the consultants, radiologists would look at this X-ray and determine whether there is a cancer or not. But now you want the image to be processed by an AI and detect it. So the justification would be, okay, this will help save time. This will prevent potential missing of any such nodules. It can ease the workload for the doctors, and so on and so forth. Now here, as you notice, the question specifically mentions the population. When it says AI-assisted lung nodules, that means people who are with certain types of cancers in the lung. So that's the population that this research would target, because it's their X-rays that they are going to assess. Then the intervention is assessing the chest X-rays using an AI model. That's the intervention. The comparison is the radiologist interpretation, because that's the standard, that's the current standard. It has to be compared with now the AI-assisted lung nodule detection to say whether that's more accurate or not, right? And the outcomes here is actually the sensitivity and the specificity, which you assess. In an AI model, you test how sensitive it is or how specific is it in terms of identifying something or identifying a particular pattern. And that's the outcome. Here, there's no time frame, and that is possible in many cases. So what I'm trying to kind of put here is that having a good research question avoids a lot of pitfalls in terms of ethics. Because if you don't identify the right population, you'll be doing a study on a population that may not be relevant to your intervention. So you are unnecessarily intervening in a population which may cause more harm than good. And our main mandate as researchers is to do no harm, that we as medical practitioners also adhere to, but at the same time as researchers also, we do that. Secondly, by having a structured approach, question, it will also help in avoiding biases. For example, just by testing an AI model based on in terms of whether it can detect a nodule or not, itself might not say whether the AI technology is better or usable in a clinical setting. Yeah, and the life and death matters. But when you say it's compared to current interpretation of uh, doctors who are doing interpretation of X-rays, then it tells us, okay, we are comparing with the standard. And that's important in ethics because it's a recognized standard that you can then use. When you define the outcomes of measure, that is sensitivity and specificity, we tell that there's no biases in terms of us telling whether the AI model is good or bad. It's not based on our own interpretation of whether it worked or not, but it's based on objective identification of sensitivity and specificity, which basically tells us that the biases that we all have biases, will be minimized as we address this particular research question. So, one fundamental things when it comes to research in any field is to having a well-defined, robust research question. Anything you need clarifications?
I guess we are fine, Professor.
Okay. Right. So that's about the research question, which is one of the key things that will determine your acceptance of a research project in an ethics review forum or anywhere for that matter. Then the objectives. Now, as reviewers of a protocol that is submitted to an ERC, this is where there are a lot of other areas, but this is also one of the key things that we will look at. Whether the objectives of that research is well defined. Unless you define the objectives or unless you adhere to the objectives, your research can impact the can be more harmful to the participants than it is being good. At the same time, if you have not defined the objectives properly, that can also mean that your research trajectory or how you're planning to undertake this research may not be robust and would be crippled or could be stopped at different points due to various reasons because you have not planned it in a way that you can gradually achieve the key objective that you have defined in your research or answer the research question for that matter. Now, in order to define the objectives properly, first you have to define the research question, as I said earlier. And based on that research question, you may then define several objectives that needs to be met in order to answer that research question. Now, for example, here, one of the examples given is this is from radiology, where evaluating the effectiveness of low-dose CT in detecting early-stage lung cancer. That's a broader research objective. The secondary objectives are helpful to meet the broader research objective. Firstly, to determine the diagnostic accuracy. Secondly, to compare and detection the rates of lung nodules using that particular technology. And then to assess the impact of low-dose CT screening. So this may not be really from technology, but it kind of emphasizes a gradual build-up to achieving your main research objective. So it may be the case with your research also. For example, again, if you plan to develop a AI model to detect nodules in an X-ray, you will not be able to do that at once. First, you may have to, gather the samples necessary and train the AI model. So that may be your first step or the first objective of your research. Secondly, you may want to test or evaluate it based on the defined criteria to see whether this can achieve a reasonable level of sensitivity or specificity in terms of identifying a pattern from a given set of data. Now, thirdly, if you are trying to implement it in clinical practice, then you also have to compare the accuracy of the CT with a standard practice, that is the traditional practice of assessing CT or an X-ray by a consultant radiologist. And when you achieve all these three objectives only, that you can say that particular AI model is capable of identifying an AI model in, from a cancerous nodule in the X-rays in a clinical setting. So this is important for you, because once you define the objectives, your research also becomes clearer, because it gives you a gradual path. You do the basic stuff, the foundational stuff first, and using those basic stuff, then you make more wider assumptions or wider arguments related to your research question. So in general, we sometimes we'll have about 3 or 4 objectives that will help you achieve. Being very specific, I have given a nomenclature that you can use. It's called SMART objectives: specific, measurable, achievable, relevant, and time bound. That helps you define an objective in a meaningful way. Once you define that, it's easy for us from an ethics review committee perspective to look at it and say, okay, these objectives are achievable. They are not harmful to anybody who are the subjects of the research. It's also easy for us as well as for the researcher to understand where the ethical concerns might arise. For example, we can discuss that later on also. For example, I would say if there is a element where you have to test the developed AI model with the standard practice of a clinician, then we know that this will require obtaining data from patients in a clinical setting, which may raise issues related to privacy, confidentiality, and so on. And it also will tell us potential issues that might arise if the AI model gives a wrong interpretation, and how do you deal with it. So the objectives itself will tell us potential areas or vulnerable populations and so on that might be subject of this study and where we need to then intervene. Hope that's clear. I can share this, and also you can read about objectives, how it's impact in terms of ethics as well. I'll move on to the next, which is about the method. Now, this is where most of the time we focus in the ethics review. Many will look at this particular aspect, because this is where you will define how you deal with people, right? Because this is where you are going to tell what sort of study you are doing, the size of the sample you are using, and how you want to collect and analyze the data. And out of these, for example, the study design. If you say it's a prospective study, which is something that you do, something you start now and follow up and finish it at a time in the future. So it's prospective. You want to kind of follow a group of people and then see how they use a tool and change their behaviors or practices in the future. So that's a good sort of a study. It's a good way of assessing how tools or technologies can actually influence people, even in terms of medicine. It may be how a tool may be used by patients or clinicians in their day-to-day practice. So that's a prospective form of study. Retrospective is you use existing data, already done data. It may be recorded somewhere, already available in clinical records or even in other registers, where you go through those data and use those in terms of study. So, as you can then understand, in prospective studies, the ethical concerns that arise linked to that would be different to retrospective studies or data that is already available and documented, where the human interaction would be minimal. Whereas in prospective studies, the human interaction will be significant. And that raises concerns related to ethics, where you want to now be more focused. Then the sample size. This is important for us to recognize, because whenever you do a research, it's important for us to ensure that we have given a uh, fair opportunity for everyone who's belonging to that population to be part of this study, right? Unless we offer that, it's unjustifiable from an ethics point of view. For example, if we are doing a study among participants at a particular hospital or a ward, then we must ensure that everyone will have the equal opportunity to participate in that study, so that we maintain equity. That is important from an ethics point of view, whether it's justifiable means of recruitment of participants. That doesn't mean that you need to have all the patients or people related to that population. What it simply means is you give the same opportunity. If it is randomized, everyone will have the same opportunity to be part of this study. Right? One thing is that ensures just equity in terms of recruitment. And on the other hand, it removes the biases. Otherwise, for example, you might select people who looks friendly, or you might select people who will be of a particular look or appearance, right? That indicates biases, and then your sample will be affected as a result. Your If you are doing an AI model or some other thing, if you are doing training, that will get affected. And your conclusions will also get affected, because ultimately you will make conclusions to the whole population, but ultimately you haven't sampled it properly. So sampling is an important thing. Sample size is more important, also because you need to have a representative sample of your population. So if you are to make conclusion of the Sri Lankan population, you have to have a representative sample. If it is Western province, you have to have a representative sample. If it is within a university, then you have to have a representative sample, right? So that way you ensure your ethical concerns are met, your biases are minimized, and that your inferences are applicable to your population. Hope that's clear. And then how you collect and analyze the data are also important, because if you're collecting data, then there are so much of things that comes to the forefront. For example, when you collect data, you cannot just go to a person and fill up a form. You must get them to give written informed consent. When we say written informed written consent, informed means we have to explain to them, this is what you are doing. These are the data that you are gathering. These are used for this particular purpose. By taking part in this study, they are not losing any other benefits or any other forms of services that they are going to get. By withdrawing also, they are not going to be, reduced of these services. They can at any time give up this study and leave themselves from the study. All that needs to be told. If it is a trial where they are using a particular tool, you have to tell that by using it, you may gain these benefits, but at the same time, in some instances, there may be certain side effects or some other harm might also come. Even to that extent, you have to tell. And you have to also tell, in any instance, there needs to be somebody who they can contact to inform things. Like, for example, if you're trialing an app, if something goes wrong, there needs to be somebody that they should be able to reach out to at any time. So all these things are part of informed written consent, which also indicates that you have to, if it is informed, it has to be put in writing. And that letter or the information sheet needs to be given to the participants. And if the ethics review committees usually require you to give it in all three languages, because we are a multilingual country. You have to justify inclusion of everyone, and that means you have to translate them into these languages and give. By doing that, you are ensuring that they have the right equal opportunity to take part. So, a lot of work. You are engaging with a human. All these things needs to be done. Even an animal you do need, but then of course you don't get consent from the animal, but most likely the owner of them. So you can also do studies on children, but given that they cannot give consent, you can then get consent from their parents. But despite that, you have to also inform the child what they are doing. If they are in a time, in a age that they can understand, you still have to inform them. And there's something called assent, where they give their okay, not by writing, but by indication. But of course, you have to get the guardian's consent in order to undertake. So generally, we are very thorough in terms of engaging vulnerable people as well as engaging children, and those will be thoroughly vetted before giving the okay for research. But on the other hand, if it's adults, then you have to follow the proper protocol. All right. Any questions so far?
Fine, Professor.
Right. So now in your research writing or proposal writing or whatever form, ethical considerations in actual writing will be a very small segment in your protocol. Even in your research papers, this will be a small segment. But that does not mean that you can avoid addressing all the relevant uh, uh, concerns. And this is where you, as the researcher, needs to think in depth, because sometimes the issues may not really be apparent, but it may manifest as you engage in your study. So you have to upfront think what you're going to do and how this impacts and what are the ethical concerns that you can have. Now, in this instance, for example, apart from informed consent, this is where you will probably explain the informed consent, how you are going to obtain it, who's going to give consent. In addition, you will also tell about how you're going to store your data and who's accessing your data, because that's an important area where privacy, confidentiality related to data is considered as one of the key things in modern day research. And of course, you might think that it may be good to collect certain data for the purpose of, keeping a record, to communicate with the participants and so on. But if that data is not used for the purpose that you have mentioned, if the personally identifiable data is not used in relation to training of an AI or in relation to giving a tool or using to assess how people have used the tool, if personal data is not relevant to it, don't collect. And the ERCs will look at it in a very thoroughly to see whether you are actually collecting any data that is not relevant to your study. So just because it's good to ask the person the address and where they live, their income and so on, just because it's good to ask, don't ask. Because it might not be relevant to the objectives you are going to measure. Right? So we are very much particular in terms of what data you are gathering. At the same time, there may be instances where you do a study with a, maybe you are doing an interview or asking person questions, giving them a tool so that the tool will give certain outputs. In some instances, these outputs or these gathering of information may cause a stress or it may not be physical, but it may be psychological harm to the patient. And in such instances, as a researcher, you have a responsibility to address those, not by your own self, but by engaging with appropriate personnel. For example, if somebody is asked a question whether they have been subjected to abuse in their childhood, that might be a very emotional thing for that person. And if that is noticed, if that is the case, then as the researcher, you should also have the responsibility to refer the person to appropriate, counselors or medical support, depending on the needs. So in the ethical part, the description of your protocol or the research, you must mention those as well. What are the steps? What are the things that you foresee? What are the steps that you may take? Um, and in some instances, you may not have much to tell. For example, if your research is based purely on existing data, no human interactions whatsoever, but the data is already available anonymously in some data set, and that's the only thing that you're going to use in your research. The ethics review committees may even decide to exempt your research from being considered for ethics review, because there are certain research with very minimal risks which can be exempted or be subjected to a quick review rather than going through a full review of its ethical issues. So it mostly happens when there's no human involvement in the study whatsoever. So, as a practice from a technical side of it, you need to get ethical approval. And of course, you have to ensure patient confidentiality and ensure fairness. And this we have discussed at different points now in terms of recruiting people, in terms of deciding the population, in terms of defining the research question, the objectives, all will contribute to these aspects that we are now illustrating here. So, though we illustrate it here, it really is linked to all components related to your study. Right. So, any questions so far? Clarifications?
I think there are some general questions, Professor. Probably we'll ask at the end of the.
All right. Okay, sure. Right. Now, budget and timeline, and you may wonder why it is ethical concern at all, budget and timeline. It's important because when you do a research, firstly, you don't to kind of mention what's your estimate in terms of spending for this particular research. Now, why the ERC or the review committees want to know is about, based on the scope of the research, your budget should be proportional. If not, if you are spending, say, millions and you are only trying to gather a few data from a set of people, it might kind of concern us as to where this money is going. The reason being that some of the research people can use money to entice people to participate. So they are not really willing contributors or willing participants of the study, but they are lured in for the study by giving them a certain amount of money, for which people there are enough people that you can actually attract. This is not ethical. So as a result, the budget as well as the timeline. Timeline is important because then we know whether what you have defined as the research objectives and the questions can be achieved within that period of time. If you are taking excessive time or you are defined a very small time frame, that tells us that this might lead to inaccurate data, incomplete data, inaccurate finding, and ultimately making inferences that are not really accurate enough, therefore cause harm to the population being studied. So as a result, the budget and timeline are must in terms of what you do as part of a research. Last but not least, references, giving appropriate references is professional, not necessarily won't be classified as ethical, but is professional in nature. As a scholar, you need to reference your research appropriately. For example, if you are developing an AI model using the latest technologies, and if we find, even in the years, if we find that the references that you have given are from 2000, 2005, 2008, 9, then we realize that what you are saying is not actually supported by up-to-date evidence. When it's not supported by up-to-date evidence, your credibility as a researcher is lost. Your responsibility as a researcher to uphold good practices is lost. And at the same time, the trust that you are trying to build through this protocol, ensuring ethical practices, may not be validated or given a good foundation because you are not being up to date in terms of your research. At the same time, you may have misled reviewers or people who are assessing your research, or anyone for that matter who reads your research. If you include references which are not actually fully referenced at the end of the document, or you may have lot of references at the end of your document in the bibliography, but you have not really used them to strengthen your arguments in the middle of your report, in-text citations, as we call it. Both of these instances are considered plagiarism. And that is an important ethical consideration, because nowadays you may have heard, you may have seen a lot of publications are being retracted by the authors after backlash, where people have questioned the credibility of, say, for example, the data, the interpretations made, the analytical method being used. So as a result, a lot of people have to withdraw their publications from very reputable journals. When that happens, the damage has already been done, because people, whenever a research is published, people will cite that, people will use that as a way of justifying their own research. So imagine the cascading effect of an unethical, poorly designed research using a falsified set of data, making claims, and then somebody else using that as the basis for their own research, and that can have a devastating impact at the end. So therefore, nowadays, sometimes journals and even some institutions, I don't know whether it's do this, also request the data set that you have used in order to train a model, or in order to arrive at the inferences, in order to back up the claims, so that that can be double checked. For you, the best way would be to consider describing everything that you do in your research, including, for example, if you are gathering data, the place of collecting that information, if you are using a device, the type of the device that you are using. Describe everything in the same steps that you did, so that somebody else, if if they follow your steps that are being described, could achieve the same results as you. And that's the whole point of writing a protocol for ethics approval, because once you publish that, anybody else can use that protocol to achieve the same result. And which tells you that you need to be very detailed and describe how you did it. And that basically essentially saves you from potential ethical as well as professional misconduct related to research. So this is what I have for today. Happy to answer any questions.
Thank you very much, Professor. It was very interesting. And if you have any questions?
Sir, can you hear me? Am I audible?
From here, yes.
Actually, sir, first of all, thank you very much for joining as a resource person today. It was very interesting and very important. And my question is, sir, when we are doing a research proposal, we have to develop a research hypothesis and null hypothesis. Can you please be kind and explain us a little bit about how to develop a good research hypothesis, and what are the things we should think about developing a hypothesis? And as a reviewer, what are the critical things that you see when a student submit a research hypothesis?
Okay, this I would say is a separate discussion altogether because it's related to the design, and we can actually do a session on that. But in essence, the hypothesis is something that you will use in order to validate your findings, yeah, in your research. And that is based largely on your research question. So your hypothesis, it's a tentative statement that you put out, and through your research, you are trying to either prove or disprove this particular hypothesis, and it may be the outcome of an experimental study. Now, for example, if we take the example of an AI model capable of identifying cancerous nodule in the X-ray, your hypothesis could be this hypothesis may be this AI model could detect let me put it this way. When you say a null hypothesis, what we are trying to do is, by doing a particular intervention, you are saying there is no difference, no significant difference. There may be a difference, but there may be no significant difference between one variable and the other. Meaning, I am saying the AI module and the traditional interpretation by a radiologist of an X-ray will not have a significant difference in detecting a cancerous nodule. That will be my null hypothesis. And through my study, I will be able to either find a significance or there may not be a significance in terms of the interpretations by the AI module and or the consultant. Then what you are essentially saying is, if you have a significance, you would say your null hypothesis is rejected. There is a recognizable significant difference between the assessment done by the AI model and by the consultant. So your research question will be the guiding force for hypothesis development. So therefore, it's important for us to first focus on the research question, get it accurate, get it very, as I said, there are frameworks that you can use in order to get it right. And based on that, for experimental type of research, these hypotheses can be put forward. And we can actually discuss it at length at a separate time, I suppose, because that itself requires us to go in depth into various aspects in doing research and also statistics analysis. Hope that kind of explains a little bit.
Thank you very much. And I have another question, sir.
Yeah.
Actually, it is about the budget. Is it ethical to put some amount for ourselves as a scientist for our time to the budget when we are doing research?
I mean, unless Dr. Lakshita is not paying you, I suppose you may have to. Right? Because, researchers are not expected to do this free, right? You are part of a project, and it all depends on the granting agency. It's not, I don't think it's related to ethics, because you're doing a service. You're not expected to, do a free service when you're part of a research team. But having said that, it is also not to say that your services are given to that research where in a way that is inappropriate or inappropriately charged, for that matter, for your time and effort that you put in. So if your budget includes proportionate amounts in terms of your own work, the whether that is acceptable or not in our context would be determined by the funding agency or your institute. Generally, we don't put. But if you use a research assistant or a data person to collect data, that sort of a person, you can budget. You put that into the budget. But other than that, unless the funding agency requests to budget the researcher's own contributions to the research, you budget. Although our practice is not really there, given that most of us are partly employed by institutions, and therefore we don't have an additional budget coming from projects. So we don't put our because it's a part of our duty, our part of our work that we do this research also. But when it comes to foreign funded research, you will note that they specifically ask the researchers time allocation for the research. Now you say full-time equivalence, whether it's a full-time equivalent one or what's the percentage of contribution. And based on that, those institutions adjust your salaries. Like, for example, if I am paid 50% full-time equivalent, which means the project will give me 50% of my salary and the institution will give me the rest of the salary. So, salary doesn't really change, but that denotes that you will spend 50% of your time in terms of doing that research. So I think it's always professional and administrative in nature, how you define. But there may be ethical concerns if you are kind of using that as a means of profiting. That's where the issues come. If it is a means of profiting, there is ethical concern. That's what, this is my overall impression, but I don't know, Lakshita, do you have any other ideas?
Thank you, sir. Thank you very much.
Professor, I have a very general question, and I think it's related to again with to AI, because we know that research is very much there's a very high impact on research by AI, and the way that research is conducted from the very beginning I mean, since the proposal writing or ideation part till the end, now AI has a big role to play, and it's already has impacted a lot. Now, when it comes to literature survey, which is a very important part, where once we have identified the problem, and then when we want to fine tune it and narrow it down, you do literature survey. But earlier it was totally different. We just go through the entire paper, we download it, and then we read the entire paper and then get the essence of it. And then we fully understand the paper, and then only we include that in when we cite it. But when it comes to AI, now you have the ability to just type a few words and then get a full summary or a comparison between several papers. And also, you don't have to spend much time on finding them. And also, you don't have to go through the entire paper. You can just get a summarized version of the paper. And so, is it really ethical to get something like that? So, without fully going through the paper and fully understanding the essence of it, is it ethical to just get using the AI models to get an analysis and use that in your paper and then cite another paper? What do you think?
Yeah, no, it's a very important question, and we are also learning too, I suppose. We are in early stages in terms of trying to deal with that kind of a situation. Um, so my personal opinion in this would be using AI tools. I wouldn't discourage for the purpose of getting an idea as to certain areas or specific problems, um, trying to identify key resources that might be available, and also in terms of defining an outline or structuring and so on and so forth. However, when it comes to, as you said, doing a literature review, there may be so many elements to a review, a thorough review of a literature than what the AI would do at present. So just because the AI says this particular study has this particular statement and that it can support our justification, when you read the study, you might notice either that particular statement is not really there, but then there may be similar or related statements made in that literature for a specific context, which is not really the context that we are looking for. Or it may be done in a certain circumstance where it's not really applicable for the study that we are planning now. And so there may be so many things other than what is being depicted in the AI-based summaries for us to consider. So most of the reviews that you get through AI models could be irrelevant. And therefore, for us to also get an understanding of what the research is available, the context in which those have been done, and so on, it's important for us to ourselves look at these studies. Even when we look at it, we don't even start reading from beginning to end. We will look at some abstract. We will look at the key segments of the study, trying to understand how it is done. So we usually, do a quick glance through those studies. At least to do that of the studies that you selected before you incorporate them in the literature review. Now, given that the students are doing this as part of their learning, there it makes more sense for the students to do their own literature review rather than using AI models to synthesize and summarize. Because otherwise that skill is lost of trying to find literature, critically evaluating a literature, a publication, and using that in order to build arguments. And that's important for, I think, from a learning point of view to go through that. So that's my perspective. I don't discourage using AI tools. And at the same time, if you are using, disclose using the AI tool. If it's for this purpose that you have used the AI tools, I think that's okay for somebody to do that. But for a learning purpose, I think, yes, I think you should do your own literature search.
Thank you, Professor. Are there any other questions?
Hello, Professor Pandula. So, there is one question: is it ethical to pay the participant when the participant is participating in the research study?
No. So we generally disclose in the information sheet that that there won't be any payment related to the person's participation in the study. However, in some studies, particularly in foreign countries, they do give some sort of a remuneration for. So, for example, if they have to travel from far away to come to that place for the purpose of the study, say, for example, to give a sample of blood, to cover that specific cost of travel or something related to their participation, but nothing to make a profit out of it. So that's the usual practice. We don't really make any payments for the purpose of sharing their data, sharing their information. But in case the participants have to incur a spend for to participate, then we may be able to budget that in our protocol.
In terms of the data protection, does it have to be password protected and encrypted both, or just one is acceptable?
So this has evolved. So those days when you didn't have all these technologies, it's basically keep it under lock and key. You keep the key with you, and that's what you do. But nowadays, if you're taking reasonable precautions to ensure security of that data, that is how the ethics review committee would look at it. And of course, you can ensure better security by encryption as well as password protections. I think that's better to having both. But the important thing, if you are not collecting personally identifiable data, that's even better.
One more question, like in the study tool, the interview questions. So, should it be completely reflected in the statistical analysis?
I would say yes, because in the questionnaire, if you're gathering data, that data is gathered for a purpose. That's why I said at the very beginning. If you're asking a question, if you're gathering the data, it is asked for the purpose of being used. Either comparisons or either classification or some purpose. It may have some usability within the study and contributing to the objectives that you have defined. So if there is a data that you are gathering in the questionnaire that you are not really using, don't gather.
Thank you, Professor. So with that, I would like to invite Janaki to
now, like here we are we are discussing about human participants. Are there like ethics related to the animals as well when we use animals in our research?
I guess, yeah, I think we are all driven by the motto, first do no harm. So even in case of animals, it's similar. As I said, the technicalities would be getting, firstly to ensure that the animals are not harmed, and that will require a very meticulous design of the study protocol. And secondly, to get consent from the owners and need appropriate consent to or engage in include the animals in the study. And I'm also not so sure whether there are other specific ethical parameters to be met. That probably there may be protocols needs to be adhered to, but that also is guided by similar ethical practice.
Any other questions? So if not, I would like to invite Janaki to formally thank Professor Siribaddana.
Yeah, first and foremost, I would like to thank Professor Pandula Siribaddana for accepting our invitation and sharing the much needed knowledge with us. So it's been true. We are truly grateful for your time and the efforts that you have invested on our students. Thank you very much. And secondly, I would like to thank our senior management for their constant leadership and Dr. Lakshita Pahalagidara for making this concept a reality. And last but not least, I thank our emerging scholars for taking part in this session. Thank you.
Thank you very much, Professor. And
Thanks
thanks
for the invitation, and it's a pleasure for me to contribute.
Thank you
Thank you
very
very
much. Have a nice evening.
Okay, bye bye.